One is that we are on the verge of doing something new totally in India. There is an organization called STEMI India, which is brought out a protocol to handle cardiac emergencies. And we are in the process, I have already written, and this has been recognized by Indian Council of Medical Research. NRHM, National Rural Health Mission, is also trying to involve this initiative into their funding pattern. So we want to be the first state. We'll have clusters, we'll have a central hospital, we'll have cluster around it, where we will deal with cardiac emergencies from the point of contact. We need to thrombolize a patient in order to increase the window period of the cardiac patient. So by giving certain things such as Elexin and other things. So this protocol has been drawn up by this organization called STEMI India. We are going to have 108 and GBK 108 and STEMI India will be signing a MOU between each other, and health department also will be a part of the MOU, how to manage this whole situation, so that in north we'll have a hospital, south we'll have a hospital, so that these patients who are thrombolized, and where we will thrombolize, not in the ambulance immediately in the first stage, we will identify certain PHCs and CHCs, we will train the doctor there, so that there itself they can thrombolize the patient. We are also including Elexin. Now we are trying to make, Honorable Chief Minister suggested that we need to relook at the Deen Dayal Swasthya Yojana, where we will make Elexin also a part. We'll cover it under insurance, because every vial costs around 15,000-20,000 rupees. So we will put it under this scheme, so that it is taken care of. And whole idea is what? To save lives.
हाजे फुडें सगळ्यो ब्लड टेस्टी GMCत करपाक सुरवात करतले. लोकांक भायर वचपाचें पडचें ना अशें विश्वजितान सांगलें.
Blood testing facility, as all of you know, goes out of Goa Medical College. People are forced to spend 800 to 2,000 rupees on blood testing facilities. That is because the wet lab is not fully functional, because of the lack of technicians. And Chief Minister has assured me that he is giving me technicians of whose contract has lapsed, need to be renewed. And these technicians, and also I am having a meeting with the same company, Abbott, on the 20th with their top management, to see that maximum blood facilities and analysis, and including cancer related testing, will be done in Goa Medical College. And one more thing which is in my mind, is stem cell banking. So stem cell banking is going to be one of the top initiatives of this government. We are just trying to study the protocol. Many times people feel that I will privatize something or do something. I am not going to privatize anything. At the most, we can outsource few facilities. That's all. That also with the consent of the government, and unanimity is there among all the cabinet, we will do it. But otherwise, we will work on strengthening of the functioning of Goa Medical College, and you be rest assured that we will make Goa Medical College a premium health institution.
प्रुडंटा खातीर व्हिडिओ जर्नलिस्ट निलेश परवार.